Thank you very much for always watching my YouTube channels. Now, we will talk about the parameters that we assess when we are doing seminal fluid analysis. I'll talk about I'll talk about the volume of the sperm. But today we'll continue. We'll talk about the pH of the semen. Now, not let us know that balance of the pH from various accessory organs, especially gland secretions. Now, the pH is balanced by different secretions from different glands. Now, the seminal vesicle secretions are usually alkaline. So, there's what we call the seminal vesicle that is close to the prostate. This produces an alkaline solution. And the prostate, which is called the prostatic secretion, also secretes an acidic secretions, had an acidic secretion. The seminal vesicles is alkaline and the prostatic secretions is acidic. A pH of less than 7 in a sample with a low volume and azoospermia, azoospermia is absence of semen, suggests that there's a problem in the ejaculatory ducts. This I will explain subsequently. For example, when there is congenital or acquired bilateral absence of vas deferens. Don't forget, I gave you the value of the pH earlier. Another thing we'll check for, the parameter we assess to find is what we call oligospermia or azoospermia. Oligospermia is defined by sperm density less than 15 to 20 million per mil. When the sperm density is less than 15 to 20 million per mil, this is considered as oligospermia. When it is lower than 5 million per mil, then this is called severe oligospermia. So oligospermia basically is defined as a reduction in sperm count. A reduction in sperm count. So for a patient that has low sperm count, what are the things we need to do for this patient? We try to assess do the hormone profile, which is called the FSH and the LH that we normally do. We also do what we also do a testosterone test. These are usually recommended for men who has oligospermia or some men who has some genetic abnormality. Now, the next thing we will talk about is azoospermia. Some men has an ejaculate. Don't forget, we talk about aspermia, no ejaculation at all. But there is an ejaculate, fluid is coming out, but this ejaculate doesn't have any form of sperm. This is what we refer to as azoospermia. Azoospermia. Now, azoospermia is defined as the absence of spermatozoa in the sample. Azoospermia refers to is the absence of spermatozoa in the sample. Now, there's what we call the cryptozospermia. Now, this enables us to identification of the spermatozoa only on the sediment of the semen when you do a test or what we call centrifugation. Now, azoospermia can be classified into two, which can either be what we call obstructive, note it, blockage, or obstructive or non-obstructive azoospermia. We're going to be discussing obstructive and non-obstructive azoospermia in our next discussion, and also trying to look at other causes, other parameters of semen analysis. Thank you very much for listening. I appreciate you all.